Good afternoon, everybody. We'll continue doing our podcast today. Our guest is Dr. Jishan from Medcare. How are you, Dr. Jishan?
Alhamdulillah, I'm good. How are you?
Alhamdulillah Rabbil Alameen. So before starting anything, Dr. Jishan, could you tell us more about yourself?
So I'm Dr. Jishan Madathil. I basically come from India. So I'm a doctor. I did my medicine from India. Then I did my master's in health administration from Australia. And I have more than 15 years of experience in Australia, India, and Middle East clubbed together. Healthcare administration has been always my passion. So with Astadim Healthcare Medcare as the Chief Operating Officer for the last 4 years, I take care of the Sharjah cluster and Northern Dubai, where we have 2 hospitals already up and running, and we have 1 more hospital coming up.
Right. Okay. We'll speak about that new hospital in a while. So I believe Medcare been here for like a decade now.
Yeah.
Can you tell us more about your journey over the last 9 years?
So when we came into Sharjah in 2017, which was almost 8 years now, and 9th year, we were not just looking at regional expansion. We were looking at bringing in world-class healthcare services into Sharjah, because what we have seen is Sharjah is a very preferred and livable emirate where the population keeps on increasing. And when it comes to academics, when it comes to quality of life, people prefer living here. And as the population growth happens, the expectations also go higher.
Right.
So we have had the privilege of launching in all the world-class, top-notch healthcare facilities, healthcare professionals locally, regionally, and globally coming in. So over the last years, the journey has been extremely good. We have positioned ourselves as the most sought-after premium healthcare organization in the private sector.
Wow.
We have a lot of trust. We have built reputation among our communities, among our clientele. Not just the Sharjah patients. We have patients coming in from Dubai. We have patients coming in from other Emirates.
Northern Emirates.
We have patients coming in from international patients too. So, so that's been our journey. And then the volumes have skyrocketed. So we continuously take the feedbacks from our patients, our customers. So they've been super happy. So alhamdulillah, it's been a great journey over the last 9 years.
So let's say 2017, at that time, 9 years from that time till now, did you expect those kind of changes happen?
So it's a very dynamic country, right?
Right.
So, but we were able to keep up the pace in which the country was growing, the vision of the country, the vision of the emirate.
Right.
So when the pace increased, we also topped up, and alhamdulillah, we were able to keep up the pace, and alhamdulillah, that's the reputation we have built in the market now. So it's been a good journey for us.
Right. So, and just if you could tell me what is the most important, or let's say milestone and achievements that you're most proud of?
So what we have looked at is for this, the clinical excellence being the top priority, right? For example, most of the healthcare organizations looks at the basic tertiary care, but we've looked at advancing from that basic tertiary care. For example, if you look at ophthalmology, so we looked at how do we subspecialize it. For example, ocular oncology, oculoplasty. When you look at ENT, we look at rhinoplasty, we look at skull base.
Right.
In neurosurgery, we look at minimally invasive spine surgeries.
Right.
So we've looked at what are the requirements of the future. We have brought in all niche programs, subspecialties. We have brought in healthcare professionals who are the epitome in their field. So that's been one of the key achievements that we could achieve. In technology, we are looking at how artificial intelligence can contribute. We are looking at how AI can facilitate imaging. We have looked at imaging to start off we have a very advanced cath lab recently installed, which looks at cardiology, neurology, and radiology.
Right. Nowadays, medicine is not only about being general, right?
Exactly.
It's more specific,
Yeah.
and you just have to keep the pace.
Yeah.
You mentioned something very interesting, that UAE is a dynamic country. And when we say dynamic country, it's that keep changing every now and then. Definitely, everybody noticed the surge in the population let's compare it between 2017 and now.
Yeah.
So this brings me to my next question. With such high demands, how is Medcare responding to that sort of growth?
Yeah. So we have adapted to the requirements of our customers. So just 16 months back, we had launched a flagship hospital under Medcare, which is called the Medcare Royal, which is in Kisais, actually, catering to both Sharjah and Dubai population.
Right.
We are happy that in just 16 months, it's turned around. So we are planning to launch our next hospital, inshallah, in November.
Wow.
So that's the next Medcare hospital coming up in Sheikh Sakar Al Qasimi Street, which is a 90-bedded facility. It's more of an expansion of our existing facility in King Faisal, which is 112 beds.
Right.
So we'll have all the specialities and subspecialties there. And we'll have whatever is lacking in the existing hospital in terms of space constraints, we'll be having it in the new hospital.
All right. I mean, we're speaking a lot about this new hospital. So what is unique about this new hospital?
So again, we have looked at what are the gaps. For example, we did a gap analysis department. So
would you like to share it?
So, for example, we have a very advanced medical oncology and surgical oncology.
Right.
So what we have seen is that there is a limited access to radiation oncology for our patients.
Okay.
So we are starting with diagnostics radiation oncology. We're starting with a PET scan. We looked at cardiothoracic surgery. A lot of conventional methodologies used. So we are bringing in a bit of an advanced interventions in cardiothoracic surgery.
Right.
We are bringing in professionals from the UK for the structural heart, for the valve replacements and the valve repairs. We are also looking at AI-enabled imaging modalities. We are looking at precision medicine because it's about linking the departments to one another, right? How can we improve the patient outcome? How can we improve the quality of life?
Right. It's just like a same hospital in different location.
Exactly.
Right.
And whatever we don't have in the existing hospital because of whatever constraints we have, it'll have in the new hospital. So cumulative, both the hospitals will be providing the entire spectrum of healthcare services the patient would expect for.
So it's just like they compromise each other. They
complete
each other.
Yeah.
That's awesome. That's a good news. I heard something that you guys are interested in transplant center as well, right?
So that's the most exciting program which we are keenly looking forward to. Inshallah, we are planning to launch the first private organ transplantation program in Sharjah and Northern Emirates.
Wow.
So when we looked at, there are 3 facilities doing in Dubai and 3 facilities doing in Abu Dhabi. For Sharjah and Northern Emirates in the private sector, nobody's doing.
Right.
So we are looking at a liver and kidney as phase 1 for both adults and pediatrics. We would be complementing that with a hepatobiliary unit.
Okay.
So we don't have a structured hepatobiliary unit now. We would be again bringing in AI because there are lots of organ wastage happening, rejections happening. So there are some studies happening where AI can contribute in deciding the right recipient for the right donor. We are clubbing it with gene therapies. For example, it improves the comorbidities, and then the outcomes can be much, much better. And as phase 2, we are looking at pancreas and intestines.
Wow.
So we have handpicked the surgeons again globally from whatever best is available. We are bringing in 17 departments together as a consortium for the transplant program. We have an earmarked transplant ICU. We have dedicated theaters. And most importantly, since it's a very regulated department, we are looking at both regional and international regulations so that we can set the gold standard in transplant program.
Right. So when are we going to see that happening?
So we are closely working with the regulatory authorities.
Right.
Inshallah, in the next 3 to 6 months, we would be doing the first transplant. That's the target, inshallah, first quarter of next year, 2026. Yeah.
So that's really transformative, to be honest. And I would like to know, what do you think the impact from this expansion and the new transplant center to have on the broader healthcare ecosystem in Sharjah?
So we always believe that collaborations are important,
Right.
but as important as collaborations are, self-reliance is also important, right? We don't want our patients to travel to other emirates or other countries to avail healthcare. So Sharjah per se as an emirate would have all the complex procedures, all the requirements met within the emirate. That's one of our success, right? That our patients, for our customers, we are able to give the best we can. And we are also keenly looking forward to have a public-private partnership, including transplants. So we are working towards it so that we can mutually collaborate, we can mutually contribute in setting up the best in healthcare.
So what's next for Medcare?
So we have various plans. So now that this hospital is coming up in November, we are keenly looking at the other locations in Sharjah and in other emirates also. So we always believe, because the global positioning of this country has been the best in hospitality, the best for safety, the best for people to live in. We just want to plug in healthcare into it to become the global healthcare leader in health in the field, so that because the country has done the foundation for us, we have to just plug in the healthcare to it. So that's our vision, inshallah.
And I'm sure since you attended Sharjah Next, I would like to have your opinion on Sharjah Next. What do you think about it?
It's beautiful. It's very ambitious, and again, like I'll come back to the dynamic nature of the country. It's because the way that things are progressing, we are discussing the future now, right? We are discussing what will happen in 2040 or 50 now. So whether it being the sustainable projects, whether it being the researches, whether it being the collaborations. So it looks very promising. It looks very futuristic. It looks very sustainable. Inshallah, it's very exciting.
And I think this is a really right place, a right platform, I would say, to collaborate and start networking with other companies as well.
Very much, yes.
Yeah, and definitely by the end of Sharjah Next, definitely a lot of people will start to know you, and they will know more about your projects, which could be really interesting for a lot of people here, a lot of companies as well.
Exactly. It's how you work together, right? Instead of working in silos, you go faster, you go deeper when you work together.
And you connect the dots. That's the mission that we're trying to achieve here at Sharjah Next.
Sure.
Thank you very much, Doctor. It was nice having you here. Thanks a lot.
Thank you so much for your time, too.
Please. Thank you.